Hello everyone, thank you for tuning into my Teach Me project number 2 for Anatomy 231. My name is Ashley Pignon and I'm going to be presenting you the muscles of the pelvic girdle and the lower limb, including the muscles' origin, insertion, and its action. Muscles of the pelvic girdle. Here I have a guy saying, get it, don't stop, very good. I really hope that you like my animations. I myself am a visual learner, so I really hope that this helps. Now let's continue to our first muscle. Gluteus maximus. Origin is the ilium and the sacrum. Insertion is the gluteal tuberosity of femur. Action extends the hip and it's the primary mover. The gluteus maximus is known as the booty shaking muscle. It is the largest muscle by volume in the entire human body, and in order for it to carry its actions, a nerve tells it what to do and when to do it. Gluteus medius. Origin, ilium. Insertion, femur. Action, abducts the hip. As you can see in the clip that I have over here to the right, it's the gluteus medius that abducts the hip, which means that it helps the hip from going from the midline outward. The gluteus medius also helps with maintaining an upright posture and balance while walking. Iliopsoas is the strongest muscle of the hip joint. This consists of two different muscles, therefore it has two different origins. One of the muscles being the psoas major, which attaches to the iliac fossa of the ilium. And then we have the iliacus muscle, which attaches to the costal processes of the T12 to L3 vertebrae. Both of these muscles meet at the insertion, which is the lesser trochanter of the femur, and its action is to flex the hip. Sartorius. Origin, anterior superior iliac spine of ilium. The insertion is on the tibia, and its actions include flexing the hip, laterally rotating the hip, and flexing the knee. The sartorius wraps like a sash on the superior aspect of the thigh. This muscle also forms the lateral border of the femoral triangle, which I will talk more about later on. I have added a picture on the left, and it's because the root actually is sartor, and it is Latin for tailor, which allows for the crossing of the leg in a seated position, used when a tailor is fitting clothing. Adductor magnus. Origin is the pubis and the ischial tuberosity of ischium. Insertion is on the femur, and the action is to adduct the hip. I know I mentioned that the insertion is on the femur, but more specifically, it's actually on the linea aspera of the femur. And not only does this muscle adduct the hip, but also assist with external and internal rotation, flexion and extension of the hip, and balances the pelvis during standing and walking. Gracilis. Origin is the pubis, insertion is on the tibia, and its action is to adduct the hip. A cool and easy way to remember is gracilis. Of all adductors, it's closest to the grass, and it's also long and thin like a blade of grass. Sciatic nerve arises from L3 to S3 nerve roots of the lumbosacral plexus. It's 2 centimeters wide and the longest and thickest nerve in the human body. So me being an LVN teaching other nurses or other future nurses, I thought it was important to actually share how to give a gluteal injection safely. And first, we look at the buttock and we divide it into 4 quadrants. You divide it by halfway down the middle and half across. And the ejection is to be given in the upper outer quadrant. And the injection and any of the other sites may cause injury to the sciatic nerve. Another way is to draw a line from the posterior superior edge of the iliac spine to the greater trochanter, and the area above the line is considered to be a safe zone for the IM injection. I tried to add a line to show that visual, but that's that red line there. Muscles of the thigh. I hope you like my sexy model here, Mr. SpongeBob SquarePants. Quadriceps femoris, origin, femur and the ilia. Insertion, tibial tuberosity via the patellar ligament, and its action is to extend the knee. This is actually a group of muscles, the strongest muscles in the human body, and I will discuss the rest of the group in the next slides. Rectus femoris, origin is anterior inferior iliac spine. Insertion is the tibial tuberosity via the patellar ligament. Action is to extend the knee. The rectus femoris is the queen of the quads. And why do you ask? It's because she sits front and center and has fem, which is female, which female would be a queen. She is supported by 3 vastus muscles. Back in the day, wealthy men called vassals supported the crown and support the back and back up the queen. Vastus lateralis, origin is on the femur. Insertion is on the tibial tuberosity via the patellar ligament, and its action is also to extend the knee. Lateralis lets you know that position of the muscle in reference to the quad. Vastus intermedius, origin is on the femur. Insertion, tibial tuberosity via the patellar ligament, and its action is also to extend the knee. The vastus intermedius runs underneath the rectus femoris. Vastus medialis, origin is on the femur. Insertion is the tibial tuberosity via the patellar ligament, and its action is to extend the knee. And since we already went over where the vastus lateralis is located, can you take a guess and let me know where the vastus medialis is? I'll give you a few seconds. And yeah, you're right. It's the medial part of the quad. Do you remember earlier that I mentioned the femoral triangle? The lateral border is made up of the sartorius, and the medial border is made up of the adductor longus. And within the triangle, we have 3 main important factors. One of them being the femoral nerve, and the common femoral artery, and common femoral vein. For this next slide, I pretty much just added all or some of the muscles that I have already talked about. One of them being the iliopsoas muscle, which I said is the psoas major and the iliacus, and it's the one right there highlighted in green. Next, in yellow, we have the rectus femoris, and to the right side of it, we have the vastus medialis in red, and in blue, we have the vastus lateralis. It also shows the sartorius in purple. Next, we will be talking about the hamstrings, and the hamstrings are basically muscles of the posterior thigh. And according to the common criteria of hamstrings, we have 3 true hamstrings. One of the true hamstrings is the semimembranosus. Origin is on the ischial tuberosity of the ischium. Insertion is the medial condyle of the tibia, and its action is to flex the knee. A way to remember semimembranosus is semimembranosus has a B, and it's located on the bottom or deep to the semitendinosus. Semitendinosus origin is the ischial tuberosity of the ischium. Insertion, medial condyle of the tibia, and its action is to flex the knee. And then another way to remember semitendinosus is that semitendinosus has a T and it sits on top of the semimembranosus. Biceps femoris. Origin, ischial tuberosity of the ischium. Insertion is on the lateral condyle of the tibia, and its action is to flex the knee. If you have trouble remembering this, biceps femoris is closer to your other biceps, which is the bicep brachii. The lateral side closest to your arm is the biceps brachii. And then again, for the last picture, I have grouped all of the true hamstrings together. And again, the group of the hamstrings are the semimembranosus, semitendinosus, and the biceps femoris. Next, we will go over the muscles of the leg, and here I have another guy from SpongeBob, the one that's always saying, "My leg." Tibialis anterior, origin is on the tibia, insertion is on metatarsal 1, and its action is dorsiflexion and ankle inversion. One thing that I learned about this muscle is that it involves squatting. And if you take a look at the clip that I have over there on the right, you can kind of see like how it could help with supporting you while you squat. Peroneus longus, also known as fibularis longus. For me personally, I think I would prefer to name this muscle the fibularis longus because I already know where the fibula is and I can associate that with the muscle. So its origin is on the fibula, insertion is on metatarsal 1, and its action is plantar flexion and ankle eversion. The fibularis longus is one of the main muscles for running, and it helps lift the heel off the ground when push off and keeps the sole of the foot in the correct position when you land. Extensor digitorum longus. Origin is the lateral condyle of the tibia and the proximal fibula. Insertion, middle and distal phalanges of the toes 2 through 5. And its action is to extend the toes. And it's located on the interior muscle of the lower leg. Gastrocnemius. Origin is the lateral epicondyle of the femur and the medial epicondyle of the femur. Insertion is the calcaneus via the calcaneal tendon, and its action is plantar flexion. A way to remember this is the gastrocnemius is the muscle you use to step on the gas in your car, and this is a superficial muscle. The soleus. Origin, tibia, and the fibula. Insertion is the calcaneus via calcaneal tendon, and its action is plantar flexion. The image that I have here on the right, it shows that the soleus is actually deep to the gastrocnemius. So the left calf shows the gastrocnemius, and the right shows deep to it, which is the soleus. This next slide is just an overview of the muscles that I had just mentioned. The first image on the right shows the anterior view of the right lower leg, and it shows the superficial muscles such as the tibialis anterior, fibularis longus, and extensor digitorum longus. The next two images on the right show the superficial and deep muscles of the posterior leg. As you can see in the middle one, the gastrocnemius has been cut, so it is showing the soleus that's right underneath it and the calcaneal tendon. Anatomy of the knee. The knee is a complex joint that relies on 4 main ligaments to provide stability and support. The lateral collateral ligament, also known as the LCL, and the medial collateral ligament, which is the MCL. The MCL runs along the inside of the knee and helps to stabilize the joint. The LCL is on the outer side of the knee and helps to support the outside of the joint. Next, we have the anterior cruciate ligament, also known as the ACL, and the posterior cruciate ligament, also known as the PCL. The ACL runs diagonally through the middle of the knee and controls rotation and forward movement in the tibia. The PCL is located in the back of the knee and controls backward movement of the tibia. Also mentioned in this slide is the medial and lateral meniscus. So the meniscus is located in the knee, and it's a cartilage that separates the femur and the tibia. From the superior view, the medial meniscus is C-shaped, and the lateral meniscus is O-shaped. Now I want you to take a look at the patella and see that there's two tendons that are connected to it. The superior tendon would be the quadriceps tendon, and it works with the quadriceps muscle for leg extension. And the patellar tendon is the one located below the patella. It is continuation of the quadricep tendon with the patella embedded in it and inserting on the tibial tuberosity. Alright everyone, that pretty much wraps my presentation on the muscles of the pelvic girdle and the lower limb. And I think this is the time that I would say like and subscribe.